Hello and welcome to Transportation's, we're going to try this again. Hello and welcome to Transportation Disability Awareness. It is a learning event brought to you by Jerry Kendrick, who works with the operational facilitator, who is an operational facilitator with the district, used to support operational staff such as transportation and yourself. Today, I'm going to ask you to make 5 commitments to this learning event. The first one is to ask questions. I realize that I'm not there, but you have some wealth of knowledge around you. So if you have a question during the time of this video, either write it down and ask later on, or raise your hand if you're in a group and ask away. Engage fully. Make sure that your attention is specifically on this training and not on your partner who's sitting next to you or some other device that might have captured your attention. Take this information and make it part of what you already know. We know that our brain research shows that if we don't integrate it, we end up losing it. Keep an open mind. You might hear something that is contrary to what you believe. My suggestion is to keep an open mind, realize that the information I'm sharing with you is based on science and research. So best options, best practices for you as you're traveling with our students. And then put into practice what you learn. You're going to hear a lot of information. And if you choose 1 or 2 things that might be new, go ahead and start putting those into practice today. Those are the 5 things that I've asked of you. What are our outcomes today? What should you expect out of our time today? First one is you should be able to identify specific disabilities and their characteristics. And we're going to pretty much focus on the ones that that you will see on a regular basis. And then I want to help you identify some strategies to support those students while they're on your bus. So I'm going to give you a couple minutes to turn to your partner if you are in a meeting. Take a second to turn to your partner. Actually, we'll do about 3 minutes. And for the next 3 minutes, I want you to identify as many disabilities as possible. And we're talking about educational disabilities. This is a way to get our thinking activated and to start our thinking to focus on disabilities and those that we might encounter on the bus. So take about 3 minutes and come up with as many educational disabilities as you might think are possible. Okay, so you've had about 3 minutes, and I hope that whomever is supporting this training with you, if it's in a group, has paused it for 3 minutes. And now I'm going to ask them to pause it again as you share out and maybe capture what your folks or what your thoughts were, your team's thoughts were as it refers to what are the types of disabilities that are out there. So go ahead and take 3 minutes again and share out. Okay, so what we're going to talk about is what our district has identified as the 14 types of disabilities that we support as a district. The first one is autism. We have deaf and blindness. We have emotional disturbance, hearing impairment and deafness, intellectual disabilities, language impairment, multiple disabilities, orthopedic impairment, other health impairment, specific learning disabilities, speech impairment, traumatic brain injury, visual impairment or blindness, and young child with developmental delay. Now, these are the 14 areas of disabilities that are educational and that SSD has made a commitment to support. So you're going to think to yourself, where did Jerry come up with these? And what I would like to offer you is a quick tutorial on our awesome ssdmo.org site. I'm going to click on that, and hopefully what it's going to do is bring up this home page right here. This page is available to the public. You do not need to work for a special school district in order to access it. And I would almost guarantee that everybody in this group or who is watching this has actually filled out their working application via this site. But what you may not know is that it is a wealth of knowledge when it comes to special school district, as well as disabilities and the types of supports that we provide. If you have never had a chance to, I strongly encourage you to take a look at this and spend some time getting familiar with it. But today I just wanted to point out that for our time, If you go under student and families and look at disability resources, you will see that on the left-hand side, those are the disabilities that I had spoken to about, the 14 disabilities that that SSD aims to provide parents and students. And if you were to click on each one, it would give you a little bit more greater, it would give you a greater information about what those disabilities look like, as well as potentially some supports to provide you as a parent or a teacher or a bus driver or whomever. It's awesome. The other thing I'm going to back up real quick is that I want to point out. I want to spend a lot of time here. I do encourage you to take advantage of this, but terms and acronyms, terms that you might not be aware of that within special school district we often use a lot: adaptive physical PE education, which is APE, all types of verbiage that you may not be aware of, as well as the acronyms that you might hear: ABE, ABS, ADA, Americans Disability Act, Adult Daycare. Those are all acronyms that you might hear while working at special school district. So just wanted to give you like a little tutorial on this. Please take, again, some time to go into ssdmo.org and take a look at the resources that are available, not only to you, but to the greater community. Now we're going to just go ahead and pile right on through. Hopefully you got to see that. If not, I do apologize. So when we think about disabilities and the type of disabilities that we often see on transportation, there are really, what I've done is pulled some data from our resources about who rides our bus. And what I've able to identify was five disabilities that are often seen receiving transportation as a service. And those disabilities usually look like somebody who might have intellectual disability, someone who might have an emotional disturbance, someone who might have multiple disabilities. We have students that ride the bus who have other health impairment, and then we have students who have autism that also require services through their IEP. And again, while these are the five main, you might see some other areas that outside of these five main disabilities that receive transportation services. We are certainly not limited to these five. I've just chosen these five as they have shown, that data has shown that they are the disabilities that often receive some type of service when it comes to transportation. All right, so let's take a couple seconds and take a breath. And now we'll take a look at autism. What is autism, and what are some services and supports I can use on the bus for students with autism? Well, the first thing you should know about autism, if you don't already, is that some of the behaviors, or what it does is behaviors of autism that you might see are disturbance of speech, language, cognitive, and nonverbal communication. Language may be absent, or if it's present, the language may lack communicative intent, meaning that they may speak words. Students with autism may say some words, but they may not necessarily indicate an intention of communication. Characteristics may involve both abnormality and delay, meaning that it's not commensurate with those of their age group. They may be using words that are much lower level, or they might be much higher level than those of their students around, or they may not even be able to communicate verbally at all at this point. We do have students with autism who have not been able to develop their, or not able to develop their speech and language skills when it comes to verbalization. There is a deficit in the capacity to use language for social communication, both understanding and being meaningful. Another behavior that you might see with a student with autism is their capacity to relate appropriately to people, events, and objects. The student might display abnormalities in relating to people, objects, and events. There's a deficit in the capacity to form relationships, meaning that it's very difficult for them to form relationships, and that might be due to their verbal abilities. It might be due to their lack of understanding social context. Students with autism, you might find that they have difficulty with understanding nuances such as facial expressions or exaggeration of words. The capacity to use an object as an age-appropriate or functional manner may be absent or delayed. The student may seek consistency in environmental events to the point exhibiting rigidity in routines, meaning that for students with autism, we know from past experience as a provider that our students with autism who are receiving transportation have difficulties with changes to routine. So understanding that helps us to prepare for students changes that in routine that might come in the future. Another area that we might see for students with autism is developmental rates and sequences, meaning that they may not develop physically, socially, or learning as quickly as their peers, or they might excel. Areas of advanced skill development may be present, while others may be develop at normal or extremely depressed rates. The order of skill acquisition frequently does not follow normal development patterns, meaning that our students might excel in some areas of learning, while they might actually have depressed rates in other. They might excel in let me see. They might excel in coming off the top of my head here, I want to make sure I am doing justice to this example. They might excel in ordering numbers or memorization, but they may not do well with remembering faces. They may not do well with remembering colors and those types of things. They may have a disturbance with response to stimuli, meaning that some of our students with autism may be very sensitive to noises or specific noises, while others won't be phased at all. That means that people and objects in their environment and can change their reception and their response rate over time. Disturbances may be apparent in their auditory, listening, their visual, their smell, their taste, or tactile, or movement responses. The students may respond to stimulation inappropriately and in a repetitive or non-meaning ways. So how do I support a student on the bus who may have autism? Well, the first thing you do is you can help keep the student calm. And how do I do this? I want to make sure I establish routines. Having a specific assigned seat is awesome. Have a specific rules and supports that you have in there. The other thing that is really important to our students is their ability to rely on the course that you are driving. If you have the same driving course that you go every day, and for some reason you know that this one road is going to be closed in the next month, you definitely want to make sure that you prepare this student with autism that the road is closing, because in their experience that you take a left on 4th Street in order to get home, and if you pass 4th Street, then they have no idea where you might be going. Familiarize yourself with your child and have them familiarize themselves with you. Do your best to avoid unnecessary changes and surprises. If you know that somebody is going to be new to the bus, or as far as support or driver, you have the ability, you might want to introduce that person and who might be taking your place if you have that opportunity, or just to make them aware that changes are coming. Be supportive. Know what works best at home and school. And the best way to be supportive in that area is to reach out to the parents, reach out to past bus drivers, past aides, reach out to past teachers, and just ask if you're having concerns or questions. And they are the ones that can give you most likely the best advice. Alleviate the fears of students. Remember, our students with autism have difficulty predicting. And so anytime changes occur in their scheduling, it makes it unpredictable. And as a kid, or even as an adult, unpredictability can be very scary. Talk about it first, or a family member about the bus riding experience. Ask that student if they have verbal capacity, how their bus riding can be better, what can we do to improve it, If they don't have verbal capacity, speak with maybe their parent or speak with their guardian or a teacher or a past aide or a past teacher, bus driver, to find out what supports this student best. Another way to prepare them is to use social stories in a way to prepare for change. If you know somebody is going to be out, you might tell a story to, let's call the kid Jonathan. You say, Jonathan, I want to tell you a story about a young boy who rode the bus every day. And then one day he had a new bus driver just for one day, and it was okay. By doing this, it helps to implement some ideas into that student that change is coming and that it's going to be okay. Again, reassuring the student about what to expect and who will be waiting for them is always good. If you know there's going to be a change in the person waiting for them to pick them up from the bus stop, that's always good to know. Sometimes students with autism are not really receptive to changes even at the home front. So if they have an aunt, uncle, family member, or whomever that doesn't normally pick them up and is waiting for them, there may be some great apprehension. The other piece that we want to make sure is that we're accommodating our child's sensory needs. You can do this by finding soothers. Some of our students are tactily calm tactily by rubbing their hands on. It could be a fur, it could be very light grid sandpaper. It can be anything that provides textual relief to that student. So what I always offer for folks is to just get a bag full of stuff, get sensory items. It can be, a while back we got these little squeezy buses that everybody got within the district, and they were made out of foam and they were able to squeeze on them and just and those are the kind of tactile things that you would want to have around. Anything to help also cancel out noise. So if you have some headphones that are noise canceling or those would be really good to support a student. So what I offer for you is to create a little bag of support. And not only does these bags work for students with autism, but they will also support students with other disabilities. Try and think like the student. If you know your student well, you know it bothers him, and you know things are going through, that the student is struggling with something, try to think like them. What is it that might be disturbing him? Maybe there is a new student who makes a noise. Maybe there is a new noise to the bus. There might be something that you're not aware of. There might be light sensitivity. There's something in the bus that's flickering. You might have a new radio or whatever it might be. Try to think like the student and come up with some ideas that might support understanding for our kids. And then prepare the students for changes in schedule. Collaborate with schools. Most of us get calendars, so we know when there's half days. Half days are real difficult, especially at the beginning of the year, because it's breaking up the schedule. The student knows at lunchtime, he usually goes to lunch, and when we have half a day, some of our kids don't even get food. They end up having to have lunch at home, and this can really create anxiety and discomfort in our students with autism. So know the schedule, the pre-planned schedule, and be ready to change. If you know a route is going to change, and look, people, I get it. I have the utmost respect, understanding, and empathy for our transportation folks, because you are dealing with change on a constant basis. But if there's any kind of change coming up that you might be aware of, you really want to take advantage of that and create a change plan for that student. And then talk through the changes. And when I mean talk through the changes, the earlier you can prepare them, the better. If you know that a change is going to happen next week, start preparing that student for that change today. Make that time to make connections and let them know that it's coming. Don't wait to the last minute. Change is difficult for our students, so we kind of have to build in that pattern of thinking in order for it to actually take effect. That's what I meant to say. And lastly, focus on teaching appropriate bus etiquette. If a student is exhibiting inappropriate behavior, don't make the assumption that they know what to do. That is not always the best assumption to make. So what you want to do is show the student how to act and what are the best policy practices to acting. You might also want to reach out to the teacher and ask the teacher what might be some ways that they can support in the classroom positive behavior on the bus. At this time, I would ask if you have any questions. Look around you. You have a lot of people who are superior when it comes to knowledge of students who have been doing this for years. Take advantage of that knowledge base. All right, the next one is emotional disability. That would be another area where you might find students with emotional issues on your bus. And the one thing I would say is, what is it? It's a condition exhibiting one or more of the following characteristics over a long period of time and marked with a degree adversely affecting his education, meaning that these characteristics impact their ability to learn. They might have an ability to learn that cannot be explained by intellectual, sensory, or health factors. They have an inability to build, maintain friendships, interpersonal relationships, not only with their peers, but with teachers. They have inappropriate types of behaviors or feelings under normal circumstances. Normally, when some people might be happy, they might get mad. And then they have a general pervasive mood of unhappiness or depression. They have a tendency to develop physical symptoms of fear associated with a personal or school problems. And now, folks, this is where I want you to keep your mind open. Often what I have heard in my 20-something years of teaching is when I'm working with students with emotional disability, there's always somebody who comes in and says, oh, they just need to have learn to respect and have greater structures around them about telling them no. This is not that case. And trust me, if this student is on your bus, these kids are not students who are just ill-behaved. They truly have an emotional disability. So don't think that you're just going to come in and be a hard person with them, because that's what they need. And that's going to change it, because that's going to exactly do the opposite. What does it look like for students with emotional disabilities? They might have physical issues such as being tired, daydreaming, anxious, nervous, tense, withdrawn, disheveled. They might have some eating disorders. Academically, they might be easily frustrated. They might be given something that a simple math problem or a math problem that isn't so simple, or a task, and it might make them frustrated and they give up easily. These are students who are dealing with an enormous amount of stress and frustration. So they give up easily. They don't consistently follow directions. There's deficits in their pragmatic communication, meaning how to communicate effectively and appropriately. Socially, they have difficulty reading social cues, whereas facial expressions, tones of our voice are usually cues for us. Those are very difficult for our students with emotional disabilities. They might often lie, steal. They might be non-compliant. They might struggle with relationships. And because of that, they might isolate themselves. They don't know how to take turns or play fair. So these are all what social characteristics of an ED student might look like. And behaviorally, they tend to be impulsive. They tend to challenge others. They're easily distracted. They're fidgety. They tend to be verbally aggressive and physically aggressive. And again, this is where I tell you folks that if you have a student with ED, emotional disability, you definitely want to pick your battles. If they have verbal aggressiveness and you realize that that's part of their disability, then what you need to realize is that it's not personal, and you might have to bend in your values or beliefs. If they might curse at you, and you're the type of person that's like, oh heck no, no 5-year-old's going to cuss at me. This is not acceptable. Well, if a student has an emotional disability, it is acceptable for their issues, and you're going to work on ways to improve verbal exchange so that they don't feel like they have to escalate to a point where they're verbally aggressive. And if they do become verbally aggressive, you need to pick and choose your battles. A cuss word is a lot easier to handle than getting hit. Trust me. So how do I support with students with emotional disabilities on my bus? The first thing I might want to do with them is to try to develop a positive relationship with that student. Remember, my behavior is definitely going to influence their behavior. So no matter how they talk to me, I'm going to speak calmly. I want to listen, because most importantly, these students want to feel like they're heard. So when they say something to me, I'm going to rephrase it back to them. What you're saying is you're upset because you wanted to sit here. You're saying is you're upset because you feel like the teacher was disrespectful to you today. I completely get it. There are times when I feel like a teacher might have disrespected me. I'm not a teacher. How can I support you and me to have a great ride home or great ride to school? There is no such thing as a power struggle if you are not struggling. You are the bus driver. What it usually comes down to is it'll end up being your way. The issue is how do you get it to be your way? The direction was to sit down, say it calmly and neutrally without emotion or anger. And that might mean you need to say it 100 times. But the idea is to ensure that you're not getting upset, that you're giving specific directions. And once that person has complied, then you might be given into whatever question or comments or concerns they have. John, I hear you. I want to help you, but right now the direction is to sit down. Once you've sat down, I'll help you out. I need you to sit down. I need you to sit down. John, thanks for sitting down. What is it that you want now? Calm, neutral tone. Do not yell. Do not have power struggles. Don't feel like it's your way or the highway, because you're just going to exacerbate the issue. Give them space. If they're really upset, John, I hear you're upset. I'm going to step away for 30 seconds. I'll be right back. And when you step away, don't have another person come in. This is what I would also suggest. Do not tag team a student with an emotional disability, meaning you are an aide, you are a teacher. One person needs to be the person of contact, and that's how that needs to develop on a bus. One person on the bus needs to be that person of contact. And you don't tag team, because it's overwhelming and it's going to create more problems than it would solve. And then remember, when you're working with students, observe and report any situation. Questions about our emotionally disturbed students? Let's move on. We have other health impairment, which is usually referred to as OHI. And within that spectrum, we have multiple things. We might have a kid who's ODD, obsessive ODD. What is ODD? I'm gonna have to come back to that. ODD. Oh, I think it's obsessive defiant disorder, specific learning disabilities, autism, anxiety, Tourette's, OCD. That's a person who is likes things the same way every day. Developmental coordination disorder. You might be gifted, sensory integration disorder, auditory depression, ADHD, attention deficit hyperactive. And then there's just ADD, attention deficit disorder. I wonder if that's what the ODD might be. I'm guessing what that's probably what that is. I do apologize for not knowing, but anyway, those are what, oh, no, it's not. Attention deficit disorder is right in the middle. Obsessive. I'll tell you what, I'll see what I can do. I tell you what, this might be a little test. If anybody can figure out what this ODD is, find out, give me an email at jkendrick@ssdmo.org, and we'll go from there. I will definitely look it up though as well. So these are the characteristics of other health impairment. Students with attention deficit hyperactive disorder, which is what we often see. They may not seem to be listening when you're talking to them, because their attention is pulled other places. They don't always make good eye contact at times, so don't be asking them to look in you in the eye. You might want to just say, hey, I realize you may not even want to point out that they're not looking at you. You just want to have verification that they heard you. John, repeat back to me what I just said. Okay, I just need to make sure we're on the same page. They can display behaviors that might be impatient or stubborn. They may struggle to follow your directions. They might be blunt, inappropriate comments without thinking or having control. They have a lot of impulse controls. As a person who has attention deficit hyperactive disorder, I have learned to control my impulses when it comes to thinking about what I say and what I think out loud all the time. I try to think about it before I say it. Often act without regarding the consequences of the behaviors, and may fidget a lot in their seats and seem like they're in motion. They also They also might tend to interrupt others when they're speaking. One thing I would offer is this: the area of our brain, all these attention deficit hyperactive are the front part of our lobes, and that's the last area of our brain to develop. So when you're working with kids who are between the ages, I'd say preschool all the way up to mid-teens, high school, that part of impulse control in their brain is still developing. And if they already have issues with it, with attention deficit, attention ADHD, then it might take a little bit longer for those processes to develop. So just remind yourself that kids are not going to be able to follow through all the time on developing that impulse control, because it's not developed as greatly as it is with you and me. How do I support students with a deficit hyperactive disorder on the bus? It's okay to continuously repeat and reinstate directions in a positive tone. The student might need lots of reminders, and they may forget what you said due to their disability. You might continuously need to model. That's one of the best things. What I found is students with ADHD, they're kinesthetic learners. They need to hear it, see it, and do it. So what you might want to do is say, this is what I want you to do. I want you to watch me, John. I want you to come on the bus, go to your chair and sit down, and you're going to do that. Then you're going to say, now let's do it together, John. So you get up, you walk on the bus together, and you both sit down together. And then you say, John, I want you to show me what we just learned. Now, listen, I just said this, and you're thinking, oh, well, this is going to take 3 minutes and we're done. No, it could be something that you practice every day, in the morning, in the afternoon. And then at some point, it becomes a personal habit for that student. So make sure that you keep your emotions in check. Show through your actions how to act appropriately. A good strategy to use visual as needed paired with your words on the right is an example of a rule card. There is no example of a rule card. It might be a piece of paper that you have that your kid has signed off, and you just hold it up and say, remember, John, we both agreed to these rules. And by showing it, at some point, you may just have to hold up that card instead of saying things. And that might be his cue to remind himself that he's made some commitments to appropriate behavior on the bus. This might be a good time to look around at your comrades and your allies and your supports to see if they could answer any questions that you might have. Now, the last one, I have two areas: multiple disabilities and intellectual disabilities. And what I've done is I've put those together, because oftentimes when we have multiple disabilities, intellectual disabilities are a part of that. So what does it look like? It's defined of having multiple disabilities is defined as having 2 or more impairments which cause severe educational needs. They often include an orthopedic, a sensory, and a behavioral or emotional concern. Common characteristics are limited speech or communication, difficult with basic mobility. They have a tendency to forget skills through disuse, which is really why summers are very hard. And a lot of our students with multiple disabilities have the ESY. They have a lot of regression. If you don't use it, they actually lose it quicker. They have the difficulty generalizing skills from one situation to other. While John might be sit quietly at one event, it might not transfer over to another event. So it might be that you have to teach those behaviors in each different setting. And they require a lot of support in major life activities. Intellectual disabilities are similar, but it's usually one area. It's where they are performing below the equivalency of their people who are their age, ethnic, or cultural backgrounds when measured by a standard instrument of cognitive ability. At one point, we really did look at using our IQs. That's not necessarily something that we always look at right now. It is definitely a part of the process for identifying, but it is not the only one that we use anymore. Students display adaptive behavior consistent with measured cognitive ability. Adaptive behavior refers to the effectiveness in which a student meets the standards of personal independence and social expectations, meaning that if the expectation is at this age, they normally behave like this and they're functioning below it, then they may have an intellectual disability. This disability adversely affects the student's educational performance. There are some common characteristics of it. They might have difficult learning new information. They have difficulty with communication and social skills. They might have a very slow cognitive processing time, meaning it takes them a while to think through and to learn it. They might have difficulties in sequencing process of information. So if you're asking them to do more than one thing at a time, what you may want to do is stop and ask them to do one thing and then move on to the next process. They might have difficult comprehending abstract concepts. That's a given. How do I support students? Speak calmly and clearly and make one request at a time. John, I need you to sit down and put your seatbelt on. No, I need you to sit down, John. After John sits down, then you're going to ask him to put his seatbelt on. You might break down instructions or requests into small steps. John, what I need you to do is just get up on the bus. Can you step up on the first step for me? Great. Can you step on the second step for me? Great. Now I want you to go down to the third seat, John. Let's count them out. 1, 2, 3. Great. Now, John, I want you to have a seat. Have students repeat the directions back to you because they'll be more likely to follow those directions, and then redirect the student as needed and repeat the directions as often as needed in a very calm and clear tone. Use gestures as you speak because those help the student explain the expectations. And then at some point, you might just be needing to gesture instead of actually say the word sit down. Sometimes it's better just to point and not use words. You should give compliments when a student is doing something is right. Remember, guys, our district adheres to 4-to-1. For every 4 redirections, we give 1 praise. For every 4 areas where we list improvement, we need to give a praise. It's very important to think about this because our direction is, John, I need you to go up 1 step. I need you to go up another step. Go up 1 more. Okay, John, stand right there. Oh my gosh, you are a superhero. Thank you for doing that. Look how good you're doing. I would like to say, if you're doing step by step like that, I encourage praise after each one. Any questions about our students with intellectual and multiple disabilities? No? I think we're almost ending to the end here. Yes, we are. So I saw the shirt and it said bus drivers are only bus people only because full-time superhero extraordinaire is not an official title. What I'd like to say is bus people. That's transportation. You guys are amazing. But I do want to leave you with 2 pieces of knowledge that I have found to be very valuable when it comes to working with students with disabilities. The first one is this. You are most likely the first person and the last person that they see representing their learning environment. If you think about this, you are the very first person they encounter when they go to school, and you might likely be the last person they encounter. And what I've learned through brain research is you can have a wonderful vacation, but it's the last thing on the vacation that makes a difference. It could have been wonderful, but on the last day, they lose your luggage. And you're like, this is terrible. Or how it starts off might be the precluder for the rest of the day. Well, if they lost my luggage, this is going to be a horrible vacation. While I make these kind of euphemisms, maybe connections to stories like that, I really cannot stress to you the importance of your job when it comes to representing the learning environment. You are special school district, you are education, you are the school, and you will be a deciding factor on how that student's day plays out and how it might end if you are that person that sees them first and last. That is a tremendous, and I don't think that people pay enough attention to you as an aide, a bus driver, routing, whomever, because it's an extraordinary position to be in. And then lastly, I say this, and this is I don't know, this is my saying, your behavior almost always dictates the behaviors of others. Almost always, because you might be sweet as pie and then you got some jerk next to you that just isn't working with it. But almost always your behavior precipitates the behavior that you're looking for. So make sure that you're always in check. I tell teachers when I was an administrator and as a teacher, I'm like, we don't change student behavior. We influence student behavior by our own behavior. So all these supports that I provided for you, those will influence the behavior of other kids. Okay. And that's really all I have for you, you guys. I think you're an amazing group of folks. If you have any comments, questions, or concerns, please get a hold of me at jkendrick@ssdmo.org. I think you guys are the best. I've always thought you guys are the best. And yeah, I think that's it. Have a wonderful day.